Today we are going to talk about colon cancer. It is one of the leading causes of cancer-related deaths in the United States. You are probably wondering, what is colon cancer? Well, the cancer is commonly found in the colon, primarily the large and small intestine. The cancer starts as small clumps of cells, called polyps, that forms in the inner lining of the large intestine. Over time, these polyps can become cancerous. Well, now let's talk about the common symptoms associated with colon cancer as well as what can increase the chance of colon cancer. It is important to know the symptoms of colon cancer so you can do your best to catch it early when it is most treatable. Symptoms include changes in bowel movement, flatulence, discomfort in the stomach region, nausea, and vomiting. Also, some individuals can experience tiredness, loss of appetite, and sudden changes in weight. The risk for developing colon cancer increase as you get older, especially after the age of 50. According to the Centers for Disease Control and Prevention, more than 90% of colon cancer cases occur in people aged 50 or older. Another risk that plays a factor is an individual who has a family history of developing colon cancer. Several genetic traits linked to colon cancer can be transferred down generations. A third risk is excessive smoking and alcohol consumption. These are all factors that contribute to developing colon cancer. A fourth risk factor is lack of physical activity, which over time can lead to weight gain. There is a strong link between weight gain and colon cancer in recent studies. All of these risks can increase the chance of colon cancer, but fortunately, there are preventive measures.
So now you may be wondering, what steps can I take to help prevent colon cancer? One of the most important things you can do is get a screening test. Screening is usually done beginning at age 50, but those with a family history of colon cancer should consider screening sooner. There are two common types of screening tests available, a colonoscopy and a stool test. During a colonoscopy, a long flexible tube called a colonoscope is inserted into the rectum and moves through the large intestine. A tiny video camera at the tip of the tube allows the doctor to view the inside of the entire colon. The scope can also shine light and blow air into the intestines, which expands the colon and helps increase visibility. The procedure will generally last around 30 to 60 minutes, and you'll be sedated with medications, so make sure to have somebody else available to drive you to and from the hospital. Before the colonoscopy, tell your doctor if you have any medical conditions such as lung or heart problems, medication allergies, or are pregnant. Your doctor will also provide you specific instructions that may involve diet restrictions and bowel cleansing with laxatives. Benefits of this test include comprehensive examination of the entire colon, ability to remove small polyps that are found during the exam, and typically is done only once every 10 years. Drawbacks include a full bowel preparation that's required, typically higher cost compared to other tests, and sedation during the procedure. The second type of screening available is a stool test. Stool tests look for hidden blood in your feces. Blood vessels in colorectal cancers are usually very fragile and easily bleed from the passage of feces, which is what the stool test detects. Your doctor will provide you with a testing kit and specific instructions on how to collect and send in your feces sample. This test is generally done once a year, and a positive result will require a follow-up colonoscopy. Benefits of this test include no need to stay at a hospital, no need for sedation or anesthesia, and no discomfort or complications. Drawbacks include potential false positives, higher frequency of testing, typically once every 1 to 3 years, and potential lack of coverage by insurance. You can also take preventative measures by making changes in your everyday life. These include eating a variety of fruits, vegetables, and whole grains, exercising at least 30 minutes a day, and maintaining a healthy weight. So, while colon cancer can be very scary and potentially fatal, some simple tests and lifestyle changes will help keep you healthy and minimize your risk. Ask your doctor if you are at risk of colon cancer and see what test is right for you. Further information can be found on www.ccalliance.org, affiliated with the Colorectal Cancer Alliance.